Today's date is November 25th, 2014, and we're here with Kay, who I think is really happy right now. Kay, would you tell the viewer what you came to see us with, please, and the time course?
Yes, I came April 2013 with a diagnosis of breast cancer. I had I had a lumpectomy, I had the lump removed in April, and I decided not to do chemotherapy or radiation, and I wanted to do some alternative treatment.
And that was totally your decision, correct?
Oh, absolutely.
I did not tell you, don't
No,
do it.
I was recommended to you because I had the need to do that, to come
Okay.
and do alternative treatment.
But I want to make sure that the viewer knows that I didn't recommend that you not do conventional
No,
therapy.
it was my decision.
Right, okay. So then what happened?
So we started on a lot of nutritionals and pills, and for about a year, I was at least 6 to 8 months. I was pretty strict with my diet. I lost about 12 to 15 pounds going on the diet that was pretty much no anything that turned to sugar. So that would be potatoes or no, not a lot of fruits, but raspberries, blueberries, and I did a drink once a day. I still am doing the drink. It's an enzyme drink, and I'm doing a few other things now too, but
You're also doing ozone, correct?
correct, I am doing
You're
ozone.
doing ozone rectally.
Correct. I started that about 3 months ago.
And you took some supplements inclusive of one called salicinium, one called carnivora, and a few others, right?
Right.
And what's happened to you?
Well, today I found out that my numbers after the blood test I took about 2.5 weeks ago are all down, and that has been since April 2014. The numbers were quite up, even after doing all that I did last year. This new regimen,
The new program
The new
has made a
program.
huge difference.
it seems to, yes.
And you first came to see me when?
I think it was around June of 2013.
Okay, so you've been with me for almost a year and a half.
Correct.
And things are actually better than when you first came to see me.
Right.
Okay.
Right.
I'm going to show your numbers in just a moment. Just tell the viewer one other thing that you're doing, which is the spiritual stuff.
Yes, I found a program called the Healing Codes, and I started this a couple months ago, and you can look it up online. That's the best thing I can recommend. But it has just helped my mind get a little bit more centered and calm, and I think that's a big part of it as well.
Thanks. And I may post this on YouTube?
Sure.
Thank you. And then this is the test we got back just today. It was drawn on 11/17/14. The HCG is down from 2 to 1.8. The HCG urine, which wasn't done before, the HIMM was 4.4. It's now 3.8. But the main one, the most important, is the PHI. The PHI was 40. Now what we're looking at here is PHI of 49.4, which was done in April. And then on November 17th, it dropped down to about 36. PHI is a key enzyme. It's called phosphohexosisomerase, and it's associated with anaerobic activity, and that's associated with cancer. So the fact that that's dropping strongly indicates a regression of cancer activity that's in her body that we may not be able to detect any other way. It's a very simple test to do, and one reason why I like this panel. Another thing about this panel, you can see HCG, human chorionic gonadotropin, which is another enzyme. HCG is actually a hormone. We associate it with the placenta. The placenta is actually an invading tissue into the mother's uterus. If an HCG is rising in a non-pregnant person, it can be indicative of one of two things: pituitary production and or a cancerous activity. As I said, the placenta is very similar to a cancer. So in her case, the HCG is falling, which is a quite a good sign. So we're happy with this um, case to date, and I thought you'd be interested in knowing about it.